Hit me. You are listening to PhysioShorts, where I share helpful articles so you waste less time and get more value. Hosted by yours truly, Dustin Jones. Hello, friends. Welcome to PhysioShorts, part of the Senior Rehab Project. I'm very excited to start this podcast as I really enjoy the Senior Rehab Shorts, the segments that I always did on the Senior Rehab Podcast every Thursday, reading articles that were helpful for me in my work. But I wanted PhysioShorts to kind of be on its own so I could read about whatever I wanted that I think would help rehab clinicians. So I'm excited for you to get to listen to this. It'll be regular, it'll be short, it'll be sweet, and hopefully a lot of value for you as the rehab clinician. I also want to let you know that the Senior Rehab Project is kind of taking the role as a podcast network. So what that's going to look like is, the Senior Rehab Podcast is still going to be trucking. PhysioShorts is going to be a regular thing, but we're also bringing on two other clinicians, Christina Novak and Mandy Chamberlain. Christina Novak has been on the Senior Rehab Podcast a couple of times. She has a website called staveoff.ca, and she's going to do a podcast geared towards patients and giving high quality advice that is in a common language and will answer questions and just provide a lot of value for the people that we actually serve. Mandy Chamberlain is an occupational therapist at seniorsflourish.com. She is going to do a geriatric focus podcast towards the occupational therapists. So we're trying to broaden our reach to impact rehab for older adults through this lovely medium that we have of podcasting. So I encourage you you can find out more information at seniorrehabproject.com for all those things. But in the meantime, do a couple favors for me. Number one, share this with one other person that you think would benefit, whether you send an email or Facebook or tweet or actually talk to a person in person. Do it. It'd be very helpful. Also, subscribe and leave a review on iTunes, especially if you've listened to the Senior Rehab Short segments before. If you leave a review for PhysioShorts, that will be very helpful in spreading the word for this new podcast. So, enough of me rambling. Let's get into this. The inaugural PhysioShorts article is actually going to come to us from Adam Meakins, aka the Sports Physio. He wrote a blog post on March 30th, 2014, titled My 10 Commandments for Physiotherapists. Now, a commandment is a divine rule, a decree given by a higher power, God's words. And although I've been accused of having a God complex from time to time, I really don't want to be seen as having one. So perhaps commandment is a bit strong. Maybe it should be my 10 suggestions for physiotherapists. But where's the controversy in that? So I think I will stick with my original title and give my critics something to moan about. But apart from winding my critics up, what I really want to do in this blog is put down some thoughts on what I think makes what makes a great physiotherapist. These commandments are based on my own observations, interactions, and experiences, and are heavily shaped by the few great physios I've had the pleasure to work with over the years. Those whose moral compasses have been straight and true. Those who have reason and rationale in a profession that is swamped with just the opposite. Those who have taught me that the power of great physiotherapy isn't in the hands, but rather the head and the heart. This blog is also heavily influenced by the many other therapists across all the professions who I have discussed, debated, and argued with, who have caused me to reflect and think long and hard on my own views, opinions, beliefs, and biases. So here we go, my 10 commandments for physiotherapists. Commandment number 1, active treatment over passive treatment. If you know me or have read any of my other blogs, you will not be that surprised that this is my first commandment. I've long been discussing, debating, some say banging on to physios to use less passive treatments for all conditions. When I say passive treatments, I mean anything that involves a patient lying down on a treatment couch and having something pressed, pulled, poked, rubbed, cracked, needled, stuck into or onto them. And when I say less, I mean less use of and less promotion of. Now, that's not to say that we shouldn't use passive treatments, nor is it me saying they don't work. Some do, a bit, at times, in certain circumstances, with certain patients, work a little bit for a short time. But all passive treatments, no matter how much you interpret, twist, contort, or torture the data, show small, short, lasting effects. So, simply put, if your physiotherapy is more doing, less doing too, positive, long lasting results will follow. Commandment number 2, exercise isn't just strengthening. Despite my background as a previous strength and conditioning coach and my clear bias towards strengthening exercises, there are many other factors to consider when using exercises. Strength, power, endurance, motor control all have their uses and different methods to achieve their goals. A thorough understanding of how human physiology responds and adapts to different modes and methods of exercise is essential, and recognizing when a patient needs one or the other is vital. The role of exercise is not just about strength of the muscle and tendons. The effects that mechanical stress, shear, and strain has on all tissues to promote healing and encourage adaptation mustn't be overlooked. Finally, exercise is not just about physical structure. Let's not forget the role exercise has in reducing pain, fear, anxiety, depression, and a host of other psychosocial issues. Another major reason and consideration for all therapists to use it. Commandment number 3, the nervous system is king. Many therapists place importance on one tissue over another, be it muscle, fascia, tendon, ligament, but simply put, neural tissue is top of the tree. When the nervous system is unhappy, everything is unhappy. It is, at last, beginning to be more widely recognized that all manual therapy affects the tissues very little, if at all. We don't treat muscle, we don't treat fascia, we don't treat tendons, we treat people with nervous systems. The interactions our hands, thumbs, exercises, even our words have on these nervous systems is far more important than how we poke or prod something. It really doesn't matter how good a massage or manipulation you are. It really doesn't matter if you have worked out a mind-bending, kick-ass rehab program with the latest exercises. If you have pissed off your patient and their nervous system with some fear-inducing comments, poor explanations, or just not connecting well with the patient, then you won't be getting any positive results anytime soon. Commandment number 4, interaction over intervention. The connection you have with your patient is everything. From the 70-year-old pensioner recovering from a total knee replacement, to the middle-aged patient enduring chronic low back pain for the last 5 years, to the 18-year-old football player hobbling in with a pulled hamstring muscle from yesterday's game. You need to connect with them all in an individual, tailored, empathetic approach. Give your patient reassurance and confidence in your professionalism and technical ability. Demonstrate that you understand, empathize, and care about their problem. Show them you are a caring human being. Have a personable, natural, and friendly manner that is genuine and honest. You don't need to be best friends with your patients, but a good connection is absolutely vital for a successful outcome. Commandment number 5, listen more, talk less. The average time a patient gets to talk uninterrupted in a medical consultation is short, really short, between 12 and 23 seconds in some research. Make a conscious effort to let patients speak freely and actively listen to what they are saying and how they are saying it. Don't just wait to speak next or be thinking about the next question you want to ask. You will learn so much more and be able to get a much clearer picture if a patient is allowed to speak freely. Don't follow a standardized assessment that can be robotic and sterile. I realize this can be tricky and challenging to do. It takes practice and experience, and you do need to ensure you ask all the relevant questions. But start practicing active listening and flexible assessments now and see the benefits soon. Commandment number 6, don't be afraid to question. That's both patients and other healthcare professionals. Talking to patients more, a lot more, to gain as much information as possible is something I truly believe in. Gaining as much information about a patient's past, family, hobbies, lifestyle, and interests not only builds rapport, but also can give you valuable insights how to manage them and also what they have caused the issue in the first place. It obviously needs to be done tactfully and considerately. You don't want to appear nosy, disrespectful, or prying, and it doesn't have to be done all in the first assessment. Questioning other healthcare professionals is even more vital. This means your peers, specialists, doctors, nurses, consultants, etc. Don't ever assume that someone with more experience than you is right. They often are, but people in authority often make mistakes. If you have doubts or questions, ask, and if needs, be challenged. Yes, this can be scary and daunting, and how you approach this needs to be professional and respectful, but if done right, it's an immensely rewarding and powerful skill. But just as you question others, expect and welcome it when others do the same to you. Commandment number 7, Admit mistakes and make adjustments as you go. If you made a mistake, admit it. Everyone does. To err is human. Cock-ups and misdiagnoses happen. However, there is nothing worse than a professional trying to cover up an honest mistake or trying to bluff and blag their way out of a bull's up. Making mistakes is fine. Not learning from them is a crime. Hypotheses and diagnoses can and often do change as a course of treatment and time progress. That's why they are called hypotheses. Be prepared to alter, adjust, or even stop a course of treatment completely. Don't blindly, stubbornly continue on if more information presents itself. Commandment number 8, don't be afraid to ask for help. From newly qualified therapists to experts, specialists, and even the gurus, they all need help from time to time. Although in my experience, the gurus don't tend to admit it. Some ask for it more often than others, but guaranteed everybody will need help, support, and guidance at some time or another. You'll never know everything. As soon as you think you do, you're lost. In this profession, there are no absolute answers, definitely no definites, and always an exception to every rule. Asking for help when needed shows honesty, humility, and experience. Commandment number 9, confront your knowledge and biases regularly. You will often and quickly fall into comfort zones in this business, finding ways of doing something, treating something that seems to work well, and then you will stick with it. Don't. Whenever you feel you are going through the motions, being prescriptive with your approach, methods, or treatments, that's when you need to look long and hard at what you are doing and what you know. Never think you have it all figured out. Never feel comfortable that what you are doing or what you have done. Look at what you know often and ask yourself, what if? Commandment number 10, read more, a lot more. Knowledge is power, and the quest for knowledge is ongoing. If you're asking yourself questions constantly, this will drive your search for answers. Read research papers, read books, read blogs, read Twitter, read anything that's relevant, or listen to a podcast or two. However, remember there is more to learning than reading alone. Observe, listen, talk, get involved, discuss, and debate with others. Interaction is a great way to learn, and remember, you don't have to agree, in which I would recommend that you go and actively seek out those that hold opposing views and ideas from your own. You can learn a lot from those you don't agree with. I have, believe it or not. So there you go, my commandments for physiotherapists. I'm sure some may disagree, and others will think I'm trying to preach. I'm not. Just trying to pass on my thoughts, opinions, and experiences. Take away what you want, ignore what you don't. It's not an exhaustive list, and one that could be added and added to. In fact, I'd love to hear what would your own 10 commandments be. So please, leave a comment below. As always, thanks for reading or listening. I appreciate it, Adam. Hit me! Thank you for listening to PhysioShorts. If you enjoyed this episode, hop on over to PhysioShorts.com where you'll find the show notes as well as my other podcasts. I appreciate you, and I'll talk with you soon. But in the meantime, do not forget to stay funky.